virtual everything. I hope everybody's managing the pandemic safely and as comfortably as possible. But today I've been asked to talk with you about a topic that's pretty sensitive, causes a lot of grief for a lot of families, but it has a lot of importance in our actual day-to-day lives. The Caregiver Foundation, like Kathy said, works with a lot of individuals. Some have the ability to make their own choices. We just help them facilitate those choices. Others have a harder time in figuring out what they should do or shouldn't do and making wise choices. And quite a few simply have lost the ability to make wise decisions for themselves and require the help of someone else in making those decisions. So the topic that we're going to go through today is making decisions for someone who can't, somebody who's lost the ability to make a decision. Now, there are a lot of different reasons for somebody needing help making decisions. When we were small, everyone here, when you were small, somebody else made decisions for you. Your mom or your dad or your older siblings. Somebody told you what to do, when to do it, how to do it, helped you do it, until you learned and developed enough experience and life skills on your own to begin learning how to put your own socks on, or that yes, you do have to get up out of bed and go to school, or when it was time to get a job, being able to figure out what job and how to perform that job satisfactorily so you ended up with a paycheck. But there are other things that happen during life that might make it impossible for you or someone else to figure out how to make a decision. You could get sick, be unable to express your wishes. You could fall down and hit your head and be unconscious. And then you really couldn't make any decisions because nobody could communicate with you. You might have a mental illness, and that could be a problem. Or you might have dementia. You might develop that. And dementia does amazing things to the brain. It can make it seem like you know exactly what's going on when you don't. And other people around you begin to realize that you're not making sense. Dementia robs the brain of the ability to function properly. And that can be a situation where someone else needs to start helping you make decisions. Now, you might be in that role for somebody. Perhaps you have a loved person with dementia or someone with a mental illness. Maybe you've been at the bedside of somebody who was sick in the hospital and the doctors turned to you and said, okay, now what? That happens to a lot of people. Unfortunately, an awful lot of people aren't prepared to deal with those questions. So usually at this point, I say, how many of you have an advanced healthcare directive? That's a little hard to see hands right now, but that's an important thing, and we'll talk about that a little bit later. But when you look at making decisions for somebody else, you really have to stop and consider, do you have that authority? Now, my mom made a lot of decisions for me. She had no problem telling me what to do, and if I didn't do it, she had a rice paddle or a slipper handy to make sure that I understood she did have that power. Thankfully, I did grow up and made my own decisions for the most part. But when you start thinking about making decisions for somebody else, you really have to consider, do I have the right? What gives me that right? What authority do I have to make a choice for somebody else? Then you've got to also think, who else is involved in making this decision? Other family members, other legal positions, exactly what are there? Who's going to deal with these? Do you have any paperwork? Are there written instructions that give you authority? Things like an advanced healthcare directive for making medical decisions for someone. Do you have a power of attorney that gives you the legal right to represent this individual's legal situations, handling their finances or their legal matters? Are you a trustee? Has a court appointed you? The A trustee doesn't always have to be court appointed, but a guardian and a conservator definitely do. So when you really start thinking about making a decision for somebody, the very first thing you have to do is step back and say to yourself, what gives me the right to decide? Now, I'm very fortunate. Both of my parents are still living, and both of them still have cognitive function that's perfectly fine. So they get to make their own decisions. Many of my clients, however, don't have the ability to understand the decisions that they make or the consequences that those decisions will have in their lives. And so I have to figure out how to make those decisions for them. I rely on a lot of paperwork. I rely on a lot of background when I'm working on somebody, with somebody, in understanding what that person needs, wants, and what their desires might have been. But the first thing that you need to do in looking at your own right to decide is it just you? Are you the only one that needs to be involved? Maybe there's other family members. I tell you, more problems in families are made by someone in the family deciding they have the right to make a decision and the rest of the family deciding they don't agree. And we've come across that before. Say that again?
That was my mistake. I'm sorry.
Oh, I'm sorry, Kathy. Okay. Yeah, if you have a question, send it over to Kathy and she'll interrupt me here and there and we'll try to address those. So think about who else is involved. Do you need to have consultation with an attorney? Do you need to have conversation with a priest, with a doctor, with another family member, with a person's close friend? It's not just you who is necessarily involved. You may think you're the only one that should be making the decisions, but that kind of thinking will lead you into a world of misery. So, do you have written instructions? Because that's the best type of thing to have. Written instructions can help you understand, one, what the person wanted to have in a decision. Maybe they have what's called a POLST, Physician's Orders for Life-Sustaining Treatment. That's usually that lime green paper that we encourage people to have on their refrigerators, so that if an emergency happens, the emergency responders can look at that and see what the basic desires are for that person's quality of life. Do they want to be resuscitated? That's very important to know. It's very important for you to know what an individual's desires are with regard to their health care. I changed mine recently. I have an advanced healthcare directive. And for most of my life, I've had it on do not resuscitate. Because I thought, well, I'm going to be old if anybody ever looks at this. Well, not that I'm not old, but I'm getting older, but I'm not too old. And I thought it would only apply if I were really at the end of life. The pandemic has really changed my perspective on that. So I had to rewrite my advanced healthcare directive to say, try to keep me alive. Maybe I can make it through this. If I can make it through, my life would be fine. I could keep going. So I had to change that. But do you have an advanced healthcare directive for the person that you may be making choices for? It's really, really important that you know what those choices are. And understand that the choices are not your choices. It's not what you want. It's what that individual wants. There was an instance a few years ago at a nursing home, assisted living facility, where an elderly lady had made it very clear that if she were to fall unconscious or her heart were to stop, she did not want to be resuscitated under any circumstance. She made sure that the staff knew it. She made sure that the owners of the facility knew it. She made sure that everybody knew it that she could think of. One day in the dining room, she dropped. She had a heart attack and was unconscious. 911 was called. EMS came. The facility handed them the advanced healthcare directive, and no attempt was made to bring her back to life, and she passed away. The people standing around were horrified. that nobody would try to do anything. But the staff and the owners of the facility were doing the right thing by following her advanced healthcare directive. It was very difficult for them to do that. And it may be very difficult for you to follow somebody's advanced healthcare directions if you're the one having to step up and say what should or should not be done. Understand that in a hospital, very seldom is the hospital going to override what you say. If you are the legal decision maker for somebody with an advanced healthcare directive, the hospital is more concerned at that moment about you suing them because they didn't follow what you said than to actually follow the individual's advanced healthcare directive. So it's up to you to make sure that you carry out the wishes of the person that you're caring for in a very ethical and straightforward way, even if it breaks your heart to do that. To make that easier, I always encourage people, when you're doing an advanced healthcare directive, turn on a video like this, think about it, and actually talk to the individual that will be having to make decisions for you. Let them see your face, hear your words. Hopefully you can encourage people around you to do something like that so that there's no clue, there's no doubt, no hidden clues in this whole matter. It's very clear. And then I also encourage what's called a quality of life statement, and we'll talk about that a little bit later. But that's sort of an expanded advanced healthcare directive that talks about what you would really like to have in life. And it's very helpful to the person making decisions to have a much clearer understanding of that. But what if you don't have a post? What if you don't have an advanced healthcare directive? There's no video to go by. There's really nothing, and you're the only one. And people are turning to you and saying, guess what? You get to decide, make a choice, find out what's going to happen here. We need to know sooner than later. Do we try to resuscitate this person? Do we take this person off life support? What is it that's going to be critical? Now, a lot of times it's not just bedside health type of decisions that we have to decide. And sometimes you have to become a little bit like Sherlock Holmes and sometimes a little bit like God. Now, what the plan is, maybe it's having to do just with financial matters or legal issues or where somebody's going to have to live or there's so many different things that can come up that you might have to be making decisions on. So how are you going to do those? How are you going to make those decisions when you have no written instructions? Maybe you're like me and you get a call from the court one day and the court says, we need your help. The family's fighting. We're tired of them fighting. Would you accept a third-party position to make decisions for this family because they're just never going to get it together? It's very hard to tell the judge no, especially when you know you're going to be in his courtroom again soon with a different case. I've had that actually happen. I don't know the person at all. And I'm being asked all of a sudden to make decisions. It's very scary at times. So I have to really get in and try to figure out what it is that this person would have decided for themselves if they could have. But let's talk about three characteristics or three approaches to making decisions that are used by the National Guardianship Association. And that's a very good organization. You can look up their website and find all kinds of very useful things in helping make decisions, because they're there for professional guardians to help increase the professionalism, the ethical standards, and the practical ways of acting as a guardian for somebody in a way that's both legally acceptable and careful, but is more importantly in that person's interest. So finding out what that person needs is really important. Now, some people don't completely lose the ability to make a decision, but they're not making smart decisions. Let me give you an example. I have a client right now who has progressive dementia. It's probably vascular dementia instead of something like Alzheimer's. So part of the time, he can really do things for himself. He can decide what he wants to eat. He can decide what he wants to wear. He can decide basically what he wants to do during the day. He's a professional uh, graphics person and loves to produce beautiful works of art. But he cannot make good decisions on his finances. He tends to give his money away to anybody who asks, to his own detriment. He also has a very hard time understanding that not everybody has his best interest at heart, so they might take advantage of him. He has beautiful things in his home. Someone comes in and they go, "Oh, that's so pretty." He ends up acting like my grandmother, who used to say, "Oh, do you like it? You can have it." And he gives things away and then later wonders where they went. What happened to that picture? What happened to that? He doesn't remember that he's given them away. But for the most part, he can do things for himself. In this standard, we use what's called supported decision making. This is when somebody can mostly do things pretty well, but they need some guidance, they need some suggestions, they need some push here and there, and then you can help draw a conclusion with their help. Now, you may have the legal right to make the decision for them. If you have a durable power of attorney and the person has been declared incapacitated, legally, you can make the decision even if the person isn't in agreement. But morally and ethically, that isn't a good thing to do. Try as much as you can to use the decisions that this individual would have made if they had full capacity. Encourage them to think about it and then listen to what they're saying. Just because someone grows old and hasn't lost the ability to make all decisions doesn't mean they don't have the capacity to understand the discussions about decisions, even if you have to override it at the end because you're certain that they're making the wrong decision. Now, I will advise you, and I am not an attorney, but any attorney would advise you, if you're going to make decisions for somebody, be sure you document everything about it. Because somebody may come along and say, "I don't think you did the right thing. I'm going to take you to court." This happens in families all the time. I was in court via virtual this week, and the judge was listening to a case where two individuals were trying to decide where their mother would be placed for long-term care. The two individuals got very upset with each other, and the judge blew up. He was really upset with them and asked them, "Do you have any kind of documentation from your mother saying where she wants to go?" Well, one of them said, "Yes, she wants to stay at home. That's what she's always said." The other one said, "No, she didn't. She said if she was ever going to be a burden, to put her somewhere." And they argued, and the judge blew up again. And then he appointed a third party to step into this situation and help figure out what is the best decision for mom. So if you make a decision, look for the paperwork first that gives you the authority, and then try to document the steps that you're taking in making the decision. So if you're using a supported decision model, write some notes down. Had a conversation on Monday, the 25th with mom. We talked about different ideas of where she could live, how she feels about it, what the financial situation is, all of the different pieces. Document what you had in that discussion and then put it aside. I hope you never have to come back to it at all. But if you do, you'll have something other than just your memory. And your memory, you shall. Now, the second step, or the second type of decision-making process, is called substituted judgment. And this is where you use what you know to make decisions for somebody that would match the decisions that person would have made for themselves. Now, that means you have to know what that person would have decided. That's not always easy, but this is where the Sherlock Holmes character comes in. You have to do your digging. If you're going to work with somebody, make decisions for them, you have the responsibility to understand what it is that they want. Now, I had a lady that we were working with a few years ago, just a delightful, delightful little lady, taught me a lot, but she was very clear that she didn't want any kind of medical intervention for anything at all, nothing. So I thought, okay, well, this is going to be interesting. She developed a kind of dementia that I'm still not sure what it was, but it was a very, very fast, very progressive dementia. She went from being in an independent living facility that she had chosen and moved to without telling any of her friends. She didn't have family. I got a call from the facility saying she was having trouble paying her bills. Would we step in and help her with that? We do that for lots of people. So I went and visited with her. She said, yeah, I'm forgetting how to write the checks. You know, things are going downhill for me, but I don't want to mess up the bills and all of my taxes and everything. So we established a position for taking care of those issues for her in paying her bills and monitoring the financial. And then I get a call about 2 months after that from the same facility saying she can't live by herself anymore. She's forgetting to eat. She's forgetting to do anything in taking care of herself. I went back to the facility and her abilities had declined so drastically that I moved her that day into assisted living so that there would be support for her. 2 weeks after that, her condition went down to the point where she needed 24-hour care, and I had to bring in professionals to be with her 24 hours a day. She passed away within 3 weeks. So it was a very, very fast, progressive situation that she had. But during this time, I had to really get to know her as well as I could so that the decisions I was having to make at a higher and higher level would match what she wanted. My inclination was to have her go to the hospital and figure out what was wrong. Why was she going downhill so quickly? But she had made it very clear that was not what she wanted. So making the decision was easier for me because I knew she would say, don't take me to the hospital. I don't want that. That was a tough position. I'll share with you something that she shared with me that I have tried to hang on to because it's been very helpful. Every time I would come to see her until the day before she passed, she would look at me and say, oh, don't worry about yesterday. You can't change anything. Never mind tomorrow, because it might not even happen. Just deal with today. So she was still able to give me wisdom as she lost the ability to make decisions for herself. Don't overlook what a person can give you while you're busy making decisions on their life needs. But always try, when you're using substituted judgment, that judgment is based on what you know. Now, there are different ways that you can figure out how somebody would want to know, and we'll talk about those in a little bit when we talk about what kinds of resources are available to you. But the third type of judgment that you have to make sometimes is when you don't know what this person would have wanted, but you're going to make decisions based on what you feel is in the best interest of the person. Now, I don't know everyone here, but let's say one of you, we're in a room and one of you were to collapse. Nobody knew you, and suddenly everybody was looking to me to make a decision for you, even though I know nothing about you. But for some reason, I had that position. Maybe the court had given it to me suddenly, or I had a paper that you had just signed that morning, or something that had given me the legal right to represent your interests. Not knowing anything about you is the most difficult position. So I would have to look at the situation and make what I think would be the best decision that would have your interests at heart. I might not make the right decision, but I make the best decision I could. Let me give you a real life example. I had a client who has a mental illness, pretty severe mental illness, and she does not take good care of herself. She was on the street. She had developed very, very significant wounds on her lower legs to the point where they had gotten so infected that she collapsed on the beach. These bystanders called 911. As her guardian, I got a call from the hospital because I didn't even know where she was. I'm guardian for a lot of people that are on the street, and that's a difficult position. But I show up at the hospital, at the emergency room, and the physicians tell me she's going to die unless we take her leg off. We've got to amputate. The infection is so bad, it's going to kill her. Do we have your permission? She can't tell me what she wants. She has a mental illness that has prevented her from telling me what she wants. So I'm making a decision in what I feel is her best interest. So I say, all right, if you have to amputate, you have my permission. So they stabilized her, sent her up to the intensive care unit, and said, okay, we're going to do this tomorrow. Okay, so I show up the next day. And guess what? She'd regained consciousness. In ICU, she was awake. She still had tubes down her throat, so she couldn't talk to me. But her mind was there. And this, besides her mental illness, she's a brilliant woman. And I began explaining to her the situation, that they were going to take her leg off because the infection was so bad that she would die unless they did that. And then I took a piece of paper, a pad of paper, and a pen, and I handed it to her, and I said, is this what you want? Is this okay for them to take your leg off? If they don't, you're probably going to die. She writes on that piece of paper, no cut, die soon, and handed it back to me. That was a very clear instruction at that point. I took the decision that I had made in her best interest, and I changed that decision. I revoked permission for the hospital to do the surgery. Now, they were furious with me because they felt that I was being abusive, that I was going to allow her to die. So I insisted that they call their ethics committee together at the hospital, explained the situation, showed them the documentation from her, and they sided with me that I was making the right decision because that was her explicit interest. So sometimes what you make a decision in might have to be changed because circumstances change. But if you're making the decision in the best interest, that's okay. If she had not regained consciousness and they had done the amputation, I would have made the right decision. Because she regained consciousness and could let me know what she wanted more clearly, I also made the best interest in changing the decision. See how complicated this can be? It's not as easy as people think. But there are lots of factors that influence decisions that we make. Some of them are our own way of thinking, what we feel, what are our beliefs. There was a situation one time where three siblings had three different faith beliefs. One was a Jehovah's Witness, one was a Baptist, and one was, I believe it was Buddhist. I'm trying to forget. Anyway, there were three differing points of view. And I was called in by the hospital to try and help negotiate some serious decisions that had to be made about taking care of their mother's last days. The person that believed in the Jehovah's Witness faith wanted nothing done that would interfere with the natural course of life. No transfusions, none of that kind of things. You couldn't do many of the things that normally would have been done because her own beliefs didn't allow them. The Baptists wanted everything done possible. It's always puzzled me that people who have such a strong belief in the afterlife are so hesitant to go to it, but that's another issue. And the third person, that was it. I'm sorry, they were from the Catholic faith. So they wanted absolutely everything done possible to keep life from ending. They were very upset with each other, but not in such a way that they were going to fight each other. Just nobody would make a decision. The hospital asked me, please, we have to have a decision here on what to do. Help them figure this out. So we went into the chapel, we talked, and I said, I'm not asking you to change what you believe, but would you three allow me as a professional to make the decision? Not asking you to make a decision at all, not asking you to change anything that you feel strongly about. I'm just asking you to give me that authority instead of having to make a decision that perhaps goes against your faith. They actually agreed to that. And I was able to go back to the physicians. We made some medical decisions, and that was it. The decision basically was taking mom off of life support. It was okay because all of those siblings could go home knowing that they didn't make the decision. It was made for their mom by somebody else. So they didn't have to feel like, oh, I have violated my own beliefs. And that's very important. But you really have to be honest with yourself when you're making decisions for somebody, to look at yourself and say, am I influenced by what I believe? Or am I actually standing in that person's shoes and making the decisions for that person? Now, sometimes you're going to get professional pressure, like I had with the doctors at the hospital in that last case. And that can be very frightening. I had a situation recently when the doctor took me aside and said, if you do not do, and they were referencing a particular position that I needed to take, in a legal position with regard to a person with dementia. They said, if you do not go to court and force that position in front of the court, I'm going to call Adult Protective Service on you because I think you'll be abusive for neglecting them. Now that kind of unnerved me. I was taking as much care of this individual as I could, and their dementia was increasing, but there were outside pressures coming in that were starting to create problems for the individual that I didn't have the legal authority to deal with. So the doctor was giving me a lot of pressure to take a legal step that we then had to do. We did take that step, but you may come in the situation where professional pressure is really intense. It may be from an attorney. It may be from a doctor. It may be from a pastor or somebody else. So you have to think hard and really consider everything, but always go back to the decision-making point. You're representing the individual who can't make a decision. You have to make the decision for that individual, not based on your beliefs, not based on somebody else's pressure. Then there's the very practical aspect of making decisions that involves our day-to-day finances. Nobody wants to hear that. But if you're making decisions for somebody, you have to make decisions based on their ability and their financial situation and your own. If I have to make a decision on caring for my parents, my inclination is to spend whatever I have to take care of them. And that's okay. But it wouldn't be what they want. It wouldn't be what they have instructed their children to do for them. They've made it abundantly clear that we are not to impoverish ourselves to take care of them. I will have a very hard time making that decision should it come to that point in my life. But we have to be honest with ourselves. The decision that we make impacts the individual that we're making the decision for. Is it also going to impact our own family, our own financial situation? Nobody wants to think, oh, money is the problem, so I'm just going to let the person die, instead of putting them in a home where it's going to cost four to six or $10,000 a month. But that's something you do have to think about. And think about it from the point of view of the individual that you're providing care for. Many of my clients have exhausted their resources completely. They don't have anything left. No money. Social Security is all the income they have. Thankfully, the government has a program called Medicaid. Medicaid's not a bad program. I don't know anybody that voluntarily wants to sign up for it because you don't have many choices that you get to make, but it is there, and it's a program that is designed to help individuals who have exhausted their resources and need help with either long-term care or medical coverage or things like that. So the three big areas in influencing your decision, again, your own beliefs, personal beliefs, professional pressure, and financial realities. So don't run from those. Factor them in and really pay attention to those. Thankfully, when we're making decisions, we have a lot of help. I've talked to so many caregivers who say, oh, it's just me. I've got to figure out all of these decisions. I'm not sure what to do, and I'm the only one making decisions for mom, for dad, for uncle, for husband, for wife. Well, if that's the position you're taking, that's a voluntary position. I hate to tell you. Ultimately, that may be true. But leading up to the actual decision, you've got lots of help available. If it's a medical decision, go to a hospital and ask to speak to their ethics people. They're there. Every hospital has an ethics committee. They'll be able to refer you to somebody to talk to. The hospitals usually have a chaplain. If they don't, all the hospice organizations have chaplains. They'll talk to you. They'll help you look at the situation and help you make a decision, or at least consider decisions that might be appropriate. You may need to talk to a person's family, maybe their friends, because you don't know the individual well enough. I had a young man last year call me up and he said, you know, my dad left us when I was 4, so I don't really know him, but he's in a coma and he has dementia, and I'm the only one left in the family, and I have to make decisions for him, and I'm not sure what to do. I said, well, did your father have any friends? He said, oh yeah, he had some friends. I said, go visit them. Find out what he was like. Ask them the difficult questions. What would your father have done if? Give them a scenario, talk to them, listen to them, try to find out the ideas that they have about what your father would have wanted. If he were able to wake up and tell you, do this, what do they think that would have been? Maybe they had professional advisors. Maybe the person you're making decisions for has an attorney or a personal physician or a counselor or some other professional in their lives that you could turn to and ask questions. Explain to the person that you have the authority and the responsibility to make decisions. What do they think? Based on their interactions with this person. What's their advice to you? Maybe it's a minister or a spiritual person in their lives. Ask questions. There's a group called Kokua Mau. Very great group. They've got lots of help available and can help walk you through decision making, especially in the healthcare side of things. Well, let me take a little break here. Kathy, do we have any questions I need to address?
Yes, we do. The first one is, my spouse has the authority under my advance directive and power of attorney, but our sons are medical professionals, a doctor and a nurse. I would like to have them involved in my medical decisions along with my spouse. How can I make that happen?
That's actually fairly easy. If you have the capacity to make those decisions now, just change your advanced healthcare directive to include them. So when it says, it depends on the form you're using, but usually it says, you know, who is going to be the person who makes decisions for you. Put all of their names down and just put a specific down in this section that says comments and say, I would like them to collaborate together in making decisions. Now, let me put a warning in there. If you leave it open-ended, you're going to have a fight among your family, almost always. So what I did in mine, my kids will be able to make decisions for me, but the medical professionals are limited in how long they can keep those decisions. So for instance, if I'm going to be resuscitated, they can try, but if I stay in a coma for 2 weeks and the doctors say to my kids, there's very little chance he's going to come out of that coma, then my kids have to let me go. So you might want to put some restrictions in on exactly how far their decision authority goes. But you can just put that advanced healthcare directive, make sure you get copies to your physician, to your hospital, to your spouse, to your kids, so that everybody knows your wishes.
Okay, the next question is supported decision recognized by the courts. I know of a case where the attorney would not accept recommendations from the PCP and case manager that the patient was impaired and at risk. The patient was being exploited financially. The attorney's position was that the patient had the right to give away all his money if he wanted to.
Okay, when you're in court, you have a judge that's going to make the decision. You make the best decisions you can, but in those situations, especially where it involves money, my advice is to make sure that you have very good documentation, preferably an attorney representing you and a medical professional that has actually declared that the individual you're caring for does not have mental capacity to make decisions. That's really, really essential. Because if you're in court and the judge asks, do you have any evidence? And you don't, they're going to rule for the other side. I was in a courtroom not too long ago where the judge, sort of a situation like this, but a little different, but the judge actually looked at the person who was saying that their person didn't have the ability to make decisions. And he said, how do you know? The guy said, well, I've known them a long time. They wouldn't make this decision. And he said, well, that's not good enough. A person has the right to make decisions, even if they're stupid decisions. So unless the person has lost legal mental capacity, they can make stupid decisions. And you don't have the right to step in unless you have the legal right to step in. So attorneys and professionals have to weigh in on that situation.
Okay. And one more, if a decision needs to be made concerning financial decisions, i.e. i.e. the broker wants a patient deemed incompetent but requires a doctor's decision, and the doctor does not want to grant this letter, what's my next action?
There are physicians who will not take a position. There are some physicians working for large corporations who will not take a position on whether somebody has legal or financial capacity. And in those instances, I go outside of that situation and I hire a recognized professional to do an actual capacity exam. These can be very extensive and expensive. But if you're going to step in to start making financial decisions for somebody and you think that there's going to be an argument down the road, my strong advice is to bring in an attorney and go find a very reputable geriatric psychiatrist or at least geriatrician who can perform recognized tests, not just the fast memory tests, but actual in-depth cognitive tests that will show pretty clearly whether a person has cognitive function adequate for making decisions on finances. Really, really critical area. More so with families than with anybody else. Most of the court cases that I see that have to do with money have family fights involved. So somebody doesn't agree with how you're spending mom's money. That's what it comes down to. So caution on that.
Okay, and that's it for now. Go ahead.
Okay. The Caregiver Foundation does work in this area a lot. So if you have a situation and you just want some fast, I can't give you legal advice, I will not give you investment advice. I can tell you pretty quickly, though, the road you need to go down in making a decision. and be able to refer you. If you're in a situation where you do need professional help and you want an organization to represent you in figuring out what to do, then give me a call. We can work on that area too. But don't forget, there's so many resources around. One of the best resources that I've seen for you is a book called Making Decisions. Basically, it's by a lady named Vicki Kind, K-I-N-D. It's well worth looking up. She has a very interesting way of helping families go through a system of making decisions. Here at the foundation, we have an extremely detailed, I guess is the best way to say it, way of making decisions. We actually have a worksheet with over 30 specific questions. There's actually about 70 questions, but there's 30 questions that go through a decision tree process in making decisions for somebody who is not able to make them for themselves. So we try to use a very standard way of doing it so that when we're in court, and we're frequently in court, we're able to present that information to the judge. He can look down the sequence of decision making and see every step that we took, and it reaches a conclusion that is logical. So you can get that sort of help too, but there's lots out there. Try not to just do it on your own. So look for religious leaders that can help you. Find the hospital ethics chief. Look for professional guardians. Look up the National Association of Guardianship. Go to the website, get information from that. They have a search tool on there if you want to find a professional guardian. You just put in where you're looking for somebody, and they will give you a reference of somebody who is certified as a national guardian. It's not an easy thing to get. I happen to be one, and it took me about 2 years of pretty strong studying to be able to pass the exam that allowed me to get that certification. The Caregiver's Path, again, by Vicki Kind, is excellent. And hospice chaplains are a wonderful, wonderful resource. I mentioned them before, but don't think that hospice is just there to help people die. They're helping people at the end of life, but often when a medical decision has to be made, the end of life is something that's part of that. And a hospice chaplain can really help you think through the situation and come to some conclusions. And then again, friends and family. Hopefully you never are in a situation where the family is arguing. I wish I could say that was a certainty for you, but I can't. But the more you talk in advance, the less likely your family is going to be fighting at the end. Think about your own life. Who's going to make decisions for you? Hopefully right now, the person that you're providing support to has provided enough information to you and everyone else that it's pretty clear what their decisions would be. That would make your life a lot easier. Now, when you make a decision, it's made. If you make a decision to take someone off life support and they are taken off life support and they die, you can't change that decision. If you make a decision to sell someone's home because they need finances to take care of them in a nursing facility, and it's gone through escrow, it's gone. The home is gone. The decision is made. You have to be sure that you're able to live with the decisions that you make. It's not always easy. Sometimes you'll make a decision and you'll go home and you'll cry because it breaks your heart. But it still may have been the right decision. But understand, when you make a decision, don't go back and second guess it again and again and again. You'll ruin the rest of your life if you do that. And if you're following decision-making steps like I've shared, then your decision should be okay. If you haven't made a decision to exploit someone, if you haven't made a decision to abuse someone, or take advantage of someone, or neglect someone, then the decisions that you've made have been for their benefit. Feel okay about that. Even if your loved one died sooner than you wanted them to, because of your decision. don't feel bad that you made the wrong decision. You can feel bad that the situation happened, that the life left early, but it still might have been the right decision. So don't beat yourself up after you've made a decision. You've really got to think carefully about that. And if you think, I'm not going to be able to live with this, I can't make this decision, then for goodness sakes, find somebody else to do it. If you have power of attorney for someone, most powers of attorney give that person the right to appoint someone else. I serve as agent for a whole bunch of people who have powers of attorney, who have guardianship, who have trusteeship over somebody, but they don't want to make the decision. So they have given me, through the court system usually, the legal right to represent them in making the decision. So they've given me that power. It kind of gives them an escape, because they can say, well, I didn't make the decision, somebody else made it for me. I mean, that guy over there, we hired him, he made the best decision he could, so that we just have to live with that. That's okay. If that's a direction that makes you able to live with the consequences of decisions, that's okay. Don't feel bad about that either. But be very honest with yourself about whether or not you are going to be able to live with decisions that you make. Let's talk a little bit about you. People are going to make decisions for you. People are going to make decisions for me. My dad, wonderful man. I said, Dad, if you're getting close to the end of life, what do you want done? He said, get me a leaky boat. He did. Knowing him, he used to be a fisherman, knowing him, he may find one for himself, I don't know. But he doesn't drive anymore, so at least he couldn't get it to the dock. But please think about yourself and those around you. What is it that you want others to know about yourself? Prepare a quality of life statement for yourself. Now, what is that? Well, think about what conditions would you be unwilling to live with? What conditions would make it where you say, I would rather be dead? Now, be careful when you say that. I was in the hospital for back surgery a few years ago, and I felt pretty miserable when I woke up. And the nurse guy that came in, he said, so how are we feeling? I said, well, we're not feeling too great. I don't know about you, but I would rather be dead right now. Well, the next thing I knew, a hospital chaplain was in there. There was a suicide counselor in there. My physician showed up. I wasn't serious, but they took it very seriously. But it made me stop and think, wait a minute, that's not something just to throw around. My family needs to know real clearly what I wouldn't be okay with putting up with in my life. So think about those things. Think about what conditions would make me not want to even stay alive. What would it be? And then what conditions, on the other hand, would you be willing to live with? If you're unresponsive, your heart has stopped, do you want CPR? How old are you? Do you realize that CPR, if you're kind of up there in years, will almost certainly break your ribs? Could puncture your lung as a result. Do you want CPR? My grandmother, if she'd had CPR, it would have killed her. So be very careful about that. Don't automatically say, oh yes, no matter what, bring me back. But make sure you've understood that people around you need to know. Do you want a feeding tube? We're in this pandemic. We may reach a state where we can't eat. But there's a good chance that with different kinds of treatment that we can be brought back. Do you want them to stop feeding you? Even if it requires a tube? Without food, we're not going to last. We are going to die. So think carefully. What about a breathing machine? We hear all of this business about not enough respirators. Well, they've kind of gotten a lot of them built now. So there usually is one available. If you have a trouble with this pandemic and you're not able to breathe, do you want a breathing machine? Right now, I do. I may not make it, but give it a good shot, because a lot of people are coming back and doing okay afterwards. And then there's a really tough question. What is a good death, in your opinion? What is it that you would like to have when your time has come? Would you rather be asleep? Would you rather be awake? Would you like your family there? Are there people that you definitely don't want there? What is it? Most of us haven't really stopped to think about what's a good death, but it's something we do need to think and to let others know. And then what is it you want to say to a person who may be making decisions for you? What is it you want to tell them? How are you going to let them know that the decisions they make are okay? That they don't need to worry, that you love them for making those decisions? Think about these things. If you can, make a video where you're talking to your wife or your kids and saying, this is what I want you to know. This is what I'd like at my bedside if I'm dying. Don't leave it to everybody else to try and decide. We have the ability right now, you and I have the ability to make decisions for those who are going to carry them out for us, and they won't have to make the decision. They will just simply have to put it down, check a box, tell the doctor, yes, that's what he wanted. They won't have to actually have to wonder if they're doing the right thing and have all the anxiety about it. I really appreciate being able to share, and I'm willing to answer any questions that I can. So, Kathy, I'm going to turn it over to you, and you can tell me what questions that I might be able to answer.
Okay, I am part of a team that helps a friend with no family with her financial and medical needs. She will be running out of money possibly in 2021. Where do we look for help finding her a less expensive place to live, and hopefully her money will last a little longer?
Okay. Medicaid has qualifications. So if the person has $2,000 or more, they're not going to qualify for Medicaid. So you have to realistically look at the amount of money and the available types of care. If it's a community care setting, that can be anywhere from $3,000 to $10,000 depending on the level of care. So rather than trying to look at how long the money might be stretched, you might want to look at what's the best level of care I can get for the money that I have right now, knowing that that individual will qualify for Medicaid once the money is used up. It may require a change in living circumstances. They might not be able to stay at Hau'oli. They might have to move into a community care home. The way I look at it is, what's the best life I can give somebody right now? Because they could die tomorrow, and then there would be money left over. Some people don't want to think of it that way. They want to stretch the money as long as possible, and there's nothing wrong with that. It just means you're going to have to compromise the quality of life according to the amount of dollars that you have available to spend. So the discussion I would have with the family is, what do you want them to have? As long a life as possible at the lower end of the financial spectrum, or the highest quality of life possible, and then transition, if they're still here to transition, to a less costly setting.
Okay. Can I instruct my family in a legally binding document that if I am so mentally incapacitated that I cannot talk or otherwise make my wishes known, that they should withhold food and water until I die, even if I am physically healthy?
Boy, that's a tough one. I'm assuming that you're thinking you'll be in a medical facility. Is that correct?
I would imagine, because it says so mentally incapacitated that he can't talk or otherwise make his wishes known.
Okay.
Well, actually, it doesn't say. If whoever wrote that can clarify what that question means. Let me see if I can find out who it was. Okay, David. Could you unmute yourself and explain what you meant?
Yeah, it was actually my wife, Dorothy, wanted to know that.
I can explain it.
Yeah, you explain it.
Hi. Well, I have a friend who has a woman in hospice care, and I've seen her, and he has to wheel her around in a wheelchair. She's like a zombie. She knows nothing. She's perfectly physically healthy. I don't want to be that way. I don't want to have my family have to come see me and have me know. Can I, in a legal document, say before that ever happens that I want to end my life, and the only way I can think of it is to withhold food and water at that point?
Okay, that's a very difficult situation. Right now, Hawaii does have the death with dignity law, but it's very complicated, and this type of situation would not fall under those legal procedures.
Right. Yeah, right.
So somebody actually withholding food and water could be charged with murder.
That's right. That's why I'm scared. So I'm asking.
It's really difficult. What I would do and what actually most people do in those circumstances is, even when somebody is really unable to do anything for themselves, frequently they have the ability to stop eating. A lot of people decide when they want to die by just stop eating. And if your advanced healthcare directive says that you're not to be tube fed or force fed, either liquid or food, then they wouldn't be able to, then it would give them the ability not to provide you food and water based on that, based on the inability of you to take it on your own and swallow.
So you have to be at the point where you can't swallow.
Yes.
That's pretty far.
It's
Well,
pretty
yeah,
far.
They can't force feed you either. They can't force feed you.
But you can tell them not to force feed you.
Yeah, you can tell them not to force feed.
But if you're at that point where you can't chew,
That's
you're almost there anyway, aren't you?
When you decide not to eat, you can stop. You cannot be.
Well,
forced
how
fed.
can I decide not to eat
Well,
when I'm not,
Well,
when I'm
you might not.
demented?
You might just stop eating, and then
Oh.
that would be.
What-
have to stop eating.
in the real world, in nursing homes, frequently what will happen is the family is clear about it, the staff is clear about it, the physicians are clear about it, hospice is clear about it. Nobody makes a real effort to get you to eat.
Mhm.
So when everybody's in agreement and understands, you don't find the nurses or the CNAs over there trying to get you to eat. They might do a spoon here and there, and if you eat it, then they'll try another one. But the minute you stop, they usually stop.
Okay.
My aunt was in this condition very much. She could not express any of her own wishes at all, and she liked to eat. She
Yeah.
could. I mean, she was a good eater until the last month, and then she began slowing down, and the staff was really good with her. Anytime she seemed that she wanted to eat something, they would help her, but the rest of the time they would leave it alone. Unfortunately, she died during this pandemic, so it was a really difficult time for the family, unable to go visit. But that's a really tough situation. But I would make sure that your family is really, really clear on what you want, so that they can, share those feelings with the professionals, and not have any sort of
You clear about that?
inkling toward heroics.
Okay. Thank
Yeah.
you.
Okay.
Thank you very much.
When my mother was dying of cancer, she quit eating. She could still eat and she could still swallow, but she just refused to eat. And I begged and pleaded because I sure didn't want her to go, but that was her choice. So I made her soup or pudding and ice cream, but she wouldn't eat anything. So that was her choice. Okay, so which nursing homes accept Medicaid?
I can't give you a complete list, but I can give you some. Pearl City Nursing Home, Leahi, up in Diamond Head area, Hau'oli,
Nani?
Alinani, Avalon. I believe that, Kathy, correct me if I'm wrong, but I think Ann Pearl does.
I'm sure they do, yeah.
Yeah. The thing to do is to call them and ask them two questions. First one is, do you accept Medicaid? If they say no, say, do you allow transition onto Medicaid? Some of them will say yes, that they won't accept Medicaid coming in on Medicaid, but if someone is there, runs out of funds, sometimes they will then allow transition onto Medicaid.
And that's not so true for care homes and foster homes.
No, almost
Yeah. Care homes,
definitely.
they want money. They want cash. They don't do Medicaid. So they will if you run out of your funds and you're in a care home, they will find you placement in a nursing home that accepts Medicaid.
Right. And even in an assisted living facility, if your level of care reaches a point that exceeds their ability to assist you, if they're not Medicaid qualified, you have to move. You have to move to a different place that is certified to take care of you and accept Medicaid. So.
Okay, next question. I am still healthy. How many years ahead of time do I need to find out which caregiving facility I would like to go to? I will make my own decisions. Where are the resources to look for these facilities?
There's a number of resources. You could go to caring.com has a good research tool on different types of homes. The Medicare website has a comparison tool that you can go look up sites and see what kind of problems they've had and how fast they've resolved them. How far in advance that, my recommendation is, if you need to go in tomorrow, where do you want to go? Next year, think about it again and keep thinking about it. This sort of stuff is something that a lot of families now are dealing with at Thanksgiving, which I always thought was kind of strange, but Thanksgiving tends to be a time when the family gets together. And I've discovered that there's quite a movement for people to express their final wishes to the entire family and have everybody have a discussion about it because they're all together. If you make that an annual event, sort of, not the whole event, hopefully, but a portion of it, you can update as you go. So it's not a mystery from one year to the next. There are amazingly lots of places opening. So new places open, and that might be better than the one you have chosen today. So you want to keep up on them. Feel free to go visit them. They all are happy to have you come visit. If it's an assisted living facility or independent living facility, almost all of them will give you a free lunch if you'll take a tour. Now, during the pandemic, it's different. You can't go visit anybody anywhere. So you need to do that based on representations and reputation if you're making a choice on someplace today. But I recommend that this is a discussion that happens early in life. I think it's up to 2.5 dozen people that I'm representing right now who are under the age of 40 who will need care for the rest of their lives. Many of them are traumatic brain injuries, kids who have done crazy things or had work accidents or something like that, but now they're not in a position where they can take care of themselves. So the idea that this is just an old age issue is not a correct thought. So really be careful and think about it early. You can always keep updating it.
As a former administrator and director of nursing at skilled nursing facilities, I would encourage you, if you're going to be looking for places, don't make an appointment. Just show up at the door.
Oh, definitely.
Yeah. And yes. there's also a book that is required to be at the front desk as you walk in the door that tells all of the surveys they've had over the past several years. That tells you what they've been cited for, if they had any complaints or other things that had to be fixed. So just look for that book as well. But don't make an appointment. Just show up unannounced so that they don't put on a pretty picture if it's not a pretty picture in real life. Just my personal opinion.
I agree. Let me throw something in there. If you're visiting somebody in a facility, don't make a reservation. Show up. If you're thinking of putting mom into a home and they say our visiting hours are between 4 and 6, I don't think that's a place to put mom. They need to be able to show up within reason. If you show up and they're saying we're giving her a bath right now, then you need to be willing to wait until she's back in her room. But there have been too many instances where there's a nice quilt that's kept in a closet and visiting hour time comes and the quilt comes out of the closet. And if you lift the quilt off, the bed is not very nice to look at. So be very careful with places that restrict visiting. So thank you, Kathy. That's so important.
Okay, ARCH and foster homes range in cost for private pay from is $10,000 for patients that are full care, such as bedridden and needed to be turned, etc. $10,000 tops. I think that's what that means.
That is not an uncommon cost for someone needing full care. In the community foster homes, sometimes you can get it at a lower rate because they have fewer clients to deal with. But in the adult residential care homes, the ARCHs, you'll usually find it up in that range. Now understand that you can negotiate. They can accept a lower rate if they will, and if they won't, you can keep looking. But don't be surprised at a $10,000 rate.
I also would like to stick in here, I'm a huge advocate for patients and family members. If you are looking at care homes or foster homes, make sure they're licensed. I'm sorry. Because some of the homes are operating unlicensed and there's no control by the government. So you need to be able to have the assurance that the ombudsman or the Department of Health can go in and do periodic inspections.
Right. If it's a home that says we're going to rent you a room and we also have a care agency that will bring somebody in to take care of you, that's not a licensed care home.
Yeah.
Don't go there.
Okay, the next question is, my mom only has Social Security. However, she has a living tenancy at my grandparents' home. The social worker stated that she would not qualify for Medicaid due to the living tenancy. I don't understand if she does not own the home and now lives with me full-time due to her dementia.
The social worker is incorrect. She could qualify for Medicaid as long as the person dealing with the Medicaid application knows how to answer the questions about tenancy. The tenancy has to be one that she has no access to. So if she doesn't have the right to sell it, but just because she has the right to live somewhere does not mean that she can live somewhere. So that can't be held against her in the Medicaid application process. Now, if the home is sold, the tenancy, the life tenancy has a cash value. There's a whole procedure in figuring out what that is. So that value would definitely be a factor in whether or not someone qualified. But it doesn't apply if the home isn't being sold and just an existing life tenancy. That in itself does not disqualify her.
Okay. What if a good Samaritan doesn't agree with how the decision maker is doing things for the patient and calls in a complaint on you? What is the decision maker's course of action?
Well, if Adult Protective Service is called in, they do a pretty good job investigating the situation, and your course of action is to show that the decisions and the care that you're providing is good. So a person, just because they don't agree with what you're doing and calls Adult Protective Service in, that doesn't mean that Adult Protective Service is going to agree with the person who reported it. Very often they find that there is not a situation that is harmful to the individual receiving care. So you want to have good records. You want to have understanding from others around you, family members or professionals around you, that the decisions that you're making are in that person's best interest. And just because Mr. Smith down the road doesn't agree with it, that doesn't mean he's right.
I'm sorry, I'm having a hard time here. I'll play that. Bye. Okay, aren't foster homes required to take at least one Medicaid client?
Yes, adult community care foster homes are under the Medicaid system, they can have either 2 or 3 beds. If they have 2 beds, 1 has to be Medicaid, 1 can be private pay. If they have 3 beds, 2 have to be Medicaid and 1 can be private pay.
Okay. So, but care homes do not have to take Medicaid.
That's correct. Adult residential care homes are not required to take Medicaid.
So I misspoke earlier and I apologize for that. Okay, since the flu shot is now available at Long's, whose job is it to take a person in a care home to get the flu shot? Will it be the POA's responsibility, or can the caregiver take the patient to get the flu shot?
Usually the caregiver can take the person to get the flu shot. It's best if you have a doctor's note. So an actual prescription for the flu shot, then there's no doubt about it. And that's usually something the clinics are quite happy to provide because they would like you to get the flu shot. It's available at Long's, is it? I have to get mine. I don't like it.
Okay, Gary, that's all the questions we have.
Great. Thank you so much. It's really an honor to be able to share, and I hope everybody stays safe during this pandemic.
It was very informative. And thank all of you for sticking around for all of these workshops. And like I said earlier, before some of you got on, we are going to have another series of workshops later on in the fall, 2 series actually, 4 weeks each. And I will email everybody with that information. And if you have any questions about anything, email me or call me anytime, okay? Thank you so much for your participation. And, oh, wait a minute, there is one more question. Sorry, hold on. I have revocable living trust, power of attorney, advanced care directives. Do I still need a professional to find a place for me to live in care home, foster home care type of places and to make decisions for my financial things?
It sounds like you have it pretty well planned out. You do want to make sure that the person you want making decisions for you as to where you're going to live and the finances, that you've really spelled that out in your power of attorney. So the advanced care directives, sometimes you have somebody else making the actual health decisions and someone else acting in your legal and financial capacity. That's pretty common. But it sounds like you have it pretty well planned out. Just make sure they all know who they are. I get calls from banks saying, oh, we see you're the trustee of so-and-so. And I go, who is that? And discover that somebody's put me down in a position that I wasn't even aware of.
Oh,
So
surprise.
let people know that you're expecting them to step in on your behalf.
Okay. And one last thing, and that's verbatim, maybe 2 last things. Can you please repeat those words of wisdom from your elderly client?
Yes. And she was such a sweetheart. Forget about yesterday. You can't change anything. Never mind tomorrow. It may not even come. Live today.
That's good.
That's my daily mantra.
And you got a lot of thank yous, Gary.
Thank you all.
That was great.
Appreciate this opportunity. Everyone take care and stay safe.
I hope to see you all in the fall later on. I'll let you know when it happens, okay? Take care.
Aloha.
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 Thank you very much.
You're welcome.
Aloha. Thank you. Mahalo.
Welcome.
Thank
Good to
you.
see everybody.